reminder, conference will now be recorded.
There we go. As a reminder, you are not muted, so please mute and unmute yourself on your phone by using *6 or the microphone icon if you're in the GoToMeeting app online. If you have any questions during the discussion, feel free to use the chat box, also in the GoToMeeting app that's on the right-hand side. And we've got a few people watching it, so we'll make sure your questions get addressed. So let's go ahead and get started. We're going to talk through the IRS guidance of HSS funding and tax implications, the EIDL portal reopening, MAP forgiveness, and then of course the EFMLA considerations with a lot of the school districts starting to open up here in a few weeks. We wanted to bring that back to the forefront. So with that, I'll hand it over to Mike, who will get us started. Mike.
All right. Hey, y'all. Good to check in with everybody again. Let's go ahead and get started. Just to that next slide. All right, this is kind of the category of starting with something that who cares, but EIDL has been open for a while, and so whether or not your hospital has gotten it, it's still available for the local physicians in the market or anybody y'all are aware of that needs it out there. And so what's happened in the last 2 weeks since we talked is that the grant portion of it has gone away. So what was happening before was that there was a $2 million cap, and then it dropped to 150. But when you applied for it and got approved for the 150, the first 10,000 was considered a grant that you didn't have to repay, and the other 140 would be repaid, going forward, starting 12 months out. But that money has been exhausted. The advance or the grant money has been exhausted. But the program is still open, and the loan applications are still being processed through there in spite of that. And so what we've heard is that there's still money available and that it's kind of pushing forward. Like we're hearing that, there's apparently plenty of PPP money to be loaned that's still outstanding currently as well. Under the HHS portion of the world, the portal for the COVID testing and treatment for the uninsured is still open. And so y'all need to continue to submit information to that. And then I know that many of y'all have gotten at least little parts of payments through that, through the submissions there. So that is still open, kind of on an open-ended basis. Not necessarily for you guys, but for some of the local providers. I'll mention again that if you're aware of a non-Medicare but Medicaid participating provider, that the portal opened for them and has been open now for the better part of a month, that would give them, allow them to upload similarly and give them the same 2% of their corporate net revenue that you guys were based on, or that all the other types of providers were based on the first two tranches, which were the $50 billion general allocation. And so, again, think independent pediatrics, those kinds of providers who were not in the Medicare program, but do take Medicaid now. And so they can upload. Now, we have heard, and from even going through the clients we touch and the IPA members that we touch, there's been a lot of not understanding that was available. And so I would encourage you to make outreach to your medical staff if you have pediatrics in your market, because they may not know what's going on with it. That said, as well, you can't go on the 20th and have them log in the first time to do anything about it. There's a process to validate the TIN as eligible as a non-Medicare, but yet Medicaid participating provider. And so it can take up to 48 hours to validate. So make sure that if you're going to do that, encourage them to go ahead and move on it. In addition to that, the portal opened to dentists last week. And so once again, it will be a 2% of their corporate tax revenue noted on their tax return. And so that is open, and we believe that will be opening the door for any other non-Medicare, non-Medicaid providers. And so with that, envision a pediatrician who doesn't take Medicaid. And so they wouldn't be in the Medicare program. They don't take Medicaid. And it looks like that those types of providers might be eligible for another round of this in the future. Next slide. All right, so what has happened, several of you guys, not several, but a few of you guys were in the safety net round. Many of you got funded. And so if you recall, they had a $10 billion safety net round, which you had to meet all three of the criteria that are below. Have a DPP percentage, a disproportionate share percentage of 20.2 or greater, have average compensated care cost per bed of 25,000 or more, and then the original rule was a profitability of 3% or less based on their baseline year that they were using, which was the 2018 cost report. Well, there are ones, of you guys, just like I'm sure there were others across the country that had that 2018 happened to be a 1-year anomaly for, a lot of Georgia rural tax credit funding. Your county subsidy happened to be higher that year, what have you, and it bumped up the bottom line and left you out. So they changed the rule for a new version of this, which would be taking the last 5 years of cost reports that an average of 3% or less on 2 consecutive years within that. And so basically for any of you who filed your 19 report, it'll be 15 through 19 and being able to pair up 15, 16, 16, 17, 17, 18, 18, 19 into a 2-year average of less than 3%. And so we've already done the math on it for those of you direct clients that we have the information, and I do think it fixes it for at least a couple of you that are in our client base. But if you're not sure, holler at us offline, or we can ask questions here, but holler at us offline and we'll walk it through with you. HHS, in theory, has done that computation themselves, and there are 9 hospitals that they've identified that are in addition to the safety net round. And so if you recall, it was a minimum of 5 million and a maximum of 50 million. So it's kind of like hitting the jackpot. So I would very much encourage you guys, if you didn't get the funding 2, 3, 4 weeks ago, to make sure you check it. And then if you don't get funded on it in the next 2 or 3 weeks, if you think you qualify, then it would be a matter of taking that back to legislative help, Buddy Carter, Senator Loeffler, whoever, to follow up on that. Next slide. Y'all stop me if you have any questions. So similar to that, if you recall 2 rounds ago for you guys, the rural hospital tranche that you guys, and there was this goofy calculation about sort of the stair-step value of that. But what it left out at the time were rural, really rural hospitals who were inside of Medicare MSA, or metropolitan statistical areas, that didn't get counted as rural. And many of those are in the MSA, but have a rural designation inside of the MSA. And so this is a cleanup of that to go back and get those facilities that if you were too close to an urban area and got caught in their MSA and got left out of that round, but you're holding the rural designation, that it goes back and gets you cleaned up. Now, as you guys recall, well, for anybody on the phone, it's kind of the same thing. Right outside of Augusta, Savannah, Macon, whoever that got left out of that round, then you may want to check into this. And there are 18 additional hospitals that HHS has identified would be eligible for this. It's the same methodology from before, where there's a graduated base payment based on the size of the organization from 1 to 3 million. And then it's basically that plus 2% or just under 2% of the hospital's operating expense. And then if you own an RHC, it's 100,000 per clinic site plus 3.6 of their operating expenses. And so it's the same methodology they used for all the rest of you guys that got it way back when. It's just allowing some more hospitals into it that were closer to the urban areas. And so again, holler at us if I would assume everything we've heard is that funding is going to start coming the next couple of weeks, 2 or 3 weeks. And if you are close to one of those areas, an urban area, and don't get it, then holler at us and it'll be kind of a similar follow-up. Beyond that, we believe that if we've got our math right, there's 20.6 billion remaining that's undesignated at this point. And so we'll be continuing to follow that along as well. Next slide. I doubt this really impacts too many of you on the phone, but the for-profit healthcare providers, IRS last Friday issued guidance that the HHS relief payments are taxable or taxable income to those entities. And so where for 98% of you if you happen to be a for-profit hospital, then you obviously need to be thinking about the tax implications for that. That's going to be a big deal to you. For everybody else on the phone, the independent physician practices that serve your hospital, they need to understand that this is the relief funding that they've been getting as they've gone through similar tranches to you guys, that it's taxable to them as well. And so, you know, for an individual physician practice, their quarterly tax filings are due now. And so, you know, they need to make sure that they're considering that in their estimates throughout the year as well. And so don't know that there's any potential penalties for it just yet, but we should be tracking that as well. Now, again, that said, there's already a push for advocacy to get rid of this. But unfortunately, now that the IRS has issued its guidance on it, any adjustments to this would be considered new spending, which means it can't be fixed at the agency level. Congress would have to approve new spending for it. And so we don't know if it might be considered as part of the fourth stimulus or what have you, but that's out there as well. And again, I guess for the for-profits as well, just a reminder that the PPP loan and forgiveness, normally loan forgiveness generates ordinary income to an organization, well, a taxable organization or to the independent physicians. And so, but that guidance is very clear in the law that the PPP expenses, the expenses covered by PPP for your physicians that are independent in the market, that those expenses are allowable to be claimed as a corporate expense, and the forgiveness of the loan, which normally would have generated ordinary income, is not going to be taxable. So all of that is still a tax exempt process, not just for the for-profit hospitals, but also for the independent practices in your market. Next slide. Just a couple of drill downs on those points. That the question was whether or not a qualified disaster relief payment is not taxable under Section 139. And so the question was posed whether or not this is a type of disaster relief, and the answer was no. That HHS and IRS guidance is that is not the case, and that the relief fund payments are going to be included in gross income. So there's that. And then just to dispense this issue, a tax exempt provider, is there any chance that the relief funds can generate some kind of taxable mechanism? And they were clear to say that the answer to that is no. Next slide. So moving on to the MAP payment. So the clock is ticking on the repayment, the recoupment. So for most of y'all, I know I go through this math every time, but for most of y'all, the funding of the prepayment came in the first half of, well, really the first half of April, maybe the end of March to the first half of April. Therefore, 120 days for most of you pushes it to the 1st of August to about mid-August. And so clock is ticking, and we're kind of running out of time on letting this play out, because the issue has been all along that A, you might have needed the money, but B, there has been a push underfoot almost since day one to forgive or grant away the funding that was advanced to all of you guys. And so the status of that is that, I think I told you 2 weeks ago that a bill had been introduced in the House side, HR 7292, the COVID-19 Hospital Forgiveness Act, which would eliminate the payback of all of that for everybody who got it. As I mentioned last time, it is specific to hospital providers only. And I'm not, we obviously represent hospitals and independent practices. And so I'm not really sure why it would have been limited to hospital only, but nonetheless, as of right now, that's the way the language is written. So there's a lot of push from the AMA and the other sort of MAG, the other physician-oriented associations to get that opened up to be all types of providers, which, again, for you advocating on behalf of the independents in your market certainly would, participate in that kind of push. But nonetheless, it's still working its way through. Congress has been on recess since the 4th. They come back on Monday, and it's our understanding that the bill is going to be slotted to committee and kind of move forward from there. But again, moving to the next slide, if you're concerned about it, I will send out the link to this. Even as late as today, I have had some folks asking for this link, and we can get our reps to send it back out to you guys. But the upshot is, if you want to ensure that your repayment occurs prior to recoupment starting and in a manner that is faster for them to recognize and more documented for them to recognize, don't send in a hard check. Send back the refund through the Palmetto e-services and then the e-check function underneath that. And so that's what they strongly encourage you to do, that their pickup of that and acknowledgement in their system to ensure that you don't get caught in handing back the money and having recoupment start at the same time is a lot faster if you remit the funds back electronically. That said, we are still concerned that if that bill from the previous slide works its way through and the ending answer is unrefunded payments are what's getting addressed to be forgiven, then jumping the gun to go back and repay your money might put you in the position that you will potentially forego the forgiveness of that. So that's our only caution with not continuing to play the game and kind of let the time run out on this a little bit farther. But nonetheless, if you're concerned about that and interested in making your repayment, then there's the link to do so, and we'll, if you need it, we'll certainly shoot it out to everybody once again. Again, stop me if you have any questions. Next slide. A lot of discussion about, you guys have gotten together the bulk of your documentation at this point. Your 8 weeks have run out, even including the incurred part. That next bill has come in, and so you've gotten the prorated portion of that ready to go and have all your documentation ready to do that. I get we're all sort of sitting on go for those of you that have decided to go after 8 weeks and not wait to the 24-week period. Problem is there's still no timeline submitted by SBA, nor sort of final what documentation are they looking for from the banks to give final approval, and kind of the guidance to the banks as well. And so I know several of y'all have sent us your letters from the banks saying that they're still waiting on guidance. A couple of them have said that they're building an electronic portal for you to submit your data back through, similar to how you submitted your information to request the loan in the first place. And so those haven't been indicated to be available as well. And so it's all kind of hurry up and wait for all that perspective. Now, remembering, of course, that there's no payments due back on it anyway right now. So it's not a lot sort of hanging on the balance of being able to do it now versus a month from now. But nonetheless, as we've been saying, they can't ask for it before 7/31. They wouldn't at this point because that's only 16 days away, but they have to. You're going to need to turn in your 941, the quarterly payroll tax form, and that's not due until 7/31. And so they can't ask for it before then. The only other thing that's kind of in addition to that, and I think everybody here who got a PPP, it's bigger than this, but again, for your local physicians, if it's less than 150,000, there's a new bill that's working its way through that would allow the loans of less than 150,000 to be automatically forgiven upon completion of a one-page document. It's even smaller than the 4-page EZ forgiveness application that they had issued a few weeks ago. So, that would be out there for local physicians who asked for a smaller amount of money. I think, as we were saying yesterday, it's acknowledgement that between the bank and HHS's point of view, it is an overwhelming amount of information and an overwhelming amount of loans. And the idea that they're going to give any real audit to smaller dollar amounts I believe this is just acknowledgement that they really weren't going to do much with those anyway. So I guess to summarize this, no rush to submit forgiveness. Yeah, if you have it all together, great, but you really can't submit it just yet, at least by our last documentation as of a day or two ago. But the last part is, and we have run into this 2 or 3 times, that for those of you who have your documentation together showing that you have spent out the dollars between the 8-week period and the incurred kind of lag on period at the end of that, make sure that you've looked at the FTE calculations, because we've had a couple of examples of the last couple of weeks where the dollars are spent, but between the 2 baseline FTE amounts versus the 8-week average, we're still below that average. And because the 6/30 period, which was the get out of jail free period, wasn't staffed back up, and that number was equally low with kind of the ongoing flow of it, the providers in the situation where, yeah, the dollars are spent now, but I have 10% fewer FTEs over the 8-week period than I did in the baseline. And so with that, 10% of the money is going to not be forgiven. And so make sure that you've done that calculation. And to the degree that leaves money on the table, then we think you got to go back and consider whether or not the 24-week version of this will clean that up and, make sure that the rest of the dollars are forgiven. So just make sure you don't forget about that portion of the calculation as you're going through it. And I think we collectively have been very focused on making sure that we're documenting that all the dollars, be it out of a separate bank account or separately accounted for, that all of those dollars are spent. But it seems to have been a little bit less focused on making sure that the FTE counts remained where they needed to be in order to ensure full forgiveness. And so that said, let's make sure that we think about that. Next slide. In kind of an update to slide that we were showing the last time or two, again, our continuing fear of what happens with self-pay over the last 60 days is, as we have done brand new reports on some of our local hospitals or our Georgia regional hospitals, it's sort of come to bear. The last 2 we've done averaged about 9% self-pay pre-COVID, one jump to 15 and one jump to 17% self-pay in the 60-day period. So very scary answer. And we are concerned that with the study saying 5.4 million American workers lost health insurance February to May, and yet 27 million have lost their jobs, there's obviously a big gap there that this can continue to get worse. And so there are advocacy efforts underway for congressional action, maybe part of Stimulus 4, maybe not, but to change the rules with COBRA, subsidize COBRA, some other kind of subsidizable options via the exchange or what have you, that would continue to have folks remain on some form of health insurance coverage for the next period of time. As we've talked about, we believe we're looking at a cliff where if the COBRA, if folks run off of COBRA soon, that sometime we've been projecting, in the early fall would be the time that the heavier amount of health insurance loss would have occurred, but it appears that it's kind of moving faster than we would have thought. But nonetheless, it's any attempts to advocate for that, we'll shoot them out to you. We think it's important for them to address this, or we're kind of looking at an underlying COVID hit that wouldn't have been sort of top of mind. Everybody sort of thinks in terms of our HHS issues as being the support for the relief funds as being incremental COVID expenses and then sort of staffing adjustments that you guys have had to do to triage patients and sort of make sure that you're checking temps and everything and the additional supplies plus the actual lost revenue. But we are concerned that equal to that will be the shift in payer mix that might be an issue to you much longer period of time than after your volume has mostly returned. And so we believe that that actually could be the larger of the $3 amounts when it's all said and done. And so again, we're in favor of any advocacy that's pushing toward making sure that people maintain coverage over the next several months through the end of the year or what have you. And so as those specific versions of that come up, we'll certainly shoot them out to you and encourage you to address them. Next slide. We have been waiting for the final version of this to come out, and if y'all are aware that this has occurred, then jump on it and tell us that. But we've been waiting for the feds to extend the public health emergency for another 90 days, given kind of the status of what's going on. It's been heavily rumored. We have been sort of assuming it's going to happen, but we hadn't seen the official documentation of it yet, because it's due to drop out 10 days from now. Well, what that means is by extending it, it would be the 20% add-on for your COVID patients, would continue the increased federal match on the Medicaid funds that the state would be getting, would continue. That would be sort of part of the budget issue that's going on now. Requirements that they cover testing without cost sharing, that would have continued. And then all the waivers that have made it easier to access telehealth would continue for the extended period of time as well. Next slide. We put this one in here. So as different school districts have considered their what they're going to do for the fall semester, there's been a lot of different answers out there. I'm hearing some in the rural areas that they're going back to school, period, end of story. Then I've seen some hybrid ones that were, you can send them back to school or we can do remote learning. And then some others like the Chatham County here in Savannah, they pushed back the start of the school by 2 weeks. And then they have said that they are definitely remote only, at least for, middle grades up for the first 9 weeks of the year. And so now we're sort of staring at another 11 weeks when, maybe as parents, we thought our kids were going to be in school and they're going to be at home again, kind of like the end of the semester last year. And I know that for a lot of you, because we knew the time was going to, the time was running out, that summer was going to start, that, as you considered the EFMLA and all those other decisions, that, there was kind of a short window on it and summer was coming and it wasn't that big a deal. Now it kind of feels open-ended. And so, as a reminder, healthcare providers can exempt themselves from EFMLA. But my overriding point is that we've been getting some feedback from you guys that maybe we need a session with Michelle and her folks, Michelle Madison and her folks, to kind of talk through this in some detail for us. And so we were thinking about scheduling that type of session for a couple of weeks from now to let you guys kind of get another deep dive into that information and talk that through with folks. Anybody want to give me some feedback on that? Is that a good idea? Or have y'all already kind of cycled through that and that's not that big an issue anymore? Anybody have a thought on that? Well, hearing nothing, but we kind of had a lot of feedback yesterday from the independent physician side. So I think we're going to schedule a session in the next couple of weeks. And I'm not sure that it necessarily has to be hospital versus physician. So maybe we can just invite everybody to the same one and kind of go from there. All right. I know that was a ton of information kind of coming at you pretty quick, but anybody have any questions or want to throw something in the chat that we need to talk about? All right. Jason, back to you.
I'm lucky silence them. All right. Well, like I said at the beginning, hopefully by the end of the day, you'll have the PowerPoint and recording uploaded to our COVID page on the SHP LLC site. And to Mike's point about the follow-up webinar here probably in a couple of weeks, look for the email as you usually get as to when that would occur. Other than that, we may be moving this to a monthly rotation with some of these one-offs in between. So we'll probably have this on a monthly schedule going forward, aside from the EFMLA, Emergency Paid Leave Act type discussion Mike was just discussing with Michelle in a couple of weeks. Other than that, we are done right at 30-minute mark. So thank you, everybody. If you have any follow-up questions or concerns, please reach out to your SHP rep and we'll be sure to get them addressed. With that, we'll wish you a good rest of your Wednesday. Thank you.
Bye, y'all. Thanks.